Did you know chemotherapy isn't always delivered in a hospital? Some patients may be able to safely receive part of their treatment at home through what's called the Chemotherapy Home Infusion Pump Program, or CHIPP for short. Hello, my name is Catherine, and I'm a registered nurse at the Ottawa Hospital Cancer Centre. In this video, I'll walk you through everything you need to know about CHIPP, what the infusion pump is, how it works, how to wear and care for it at home, and what to do if there's ever a spill. You'll have received a booklet with this same information. You can follow along with it or use it for reference at any time. Before we talk about the pump itself, it helps to understand where the medication goes. And that starts with something called a central line, or CVAD. A central line is a semi-permanent IV that can stay in place for many months. It can help protect the small veins in your arms from damage that can happen with regular IVs, and it allows your care team to safely deliver chemotherapy and other treatments directly into a larger vein near your heart. There are two main types of central lines used in the CHIPP program, a port or a PICC line. Everyone receiving treatment through an infusor will have one of these in place. Let's take a closer look at each one. This is what a port looks like. It's a small medical device placed just under your skin through a small incision, usually in the upper chest. During this procedure, you're given medication to keep you comfortable and pain-free. Let's take a closer look at how it's placed. This small raised area of the port is made of soft rubber. It's called a septum. That's the part that sits just under the skin, right about here. It's where a special needle is inserted to access the port. And this is the catheter, a thin, flexible tube that connects to the septum and runs into a large vein in your heart. This is what carries the medication from the port into your bloodstream, and it allows for easy, comfortable access during treatment. That's how a port works. It stays under the skin and connects directly to a vein near your heart. Now let's look at another type of central line we sometimes use. It's called a PICC line, which stands for Peripherally Inserted Central Catheter. It's a soft, flexible tube that's used to give you your treatment. It's placed in a vein in your upper arm and gently guided into a larger vein near your heart. Let's look at where it sits inside your body. So here's your heart, here's your vein, and this is where the PICC line is inserted, right into a vein here. From there, it's carefully guided via ultrasound through your veins until it reaches the large vein near your heart. It stays in place here where it comes out of your arm, and it can remain for several weeks to months, depending on your treatment plan. Just like the port, it helps avoid repeated needle pokes and makes treatment easier and more comfortable. So now that you know how your central line works, whether you have a port or a PICC, let's look at the device that delivers your chemotherapy. This is your infusor. It looks a little like a baby bottle, but inside there's a special balloon filled with chemotherapy medication. The outer shell is a hard plastic, and the balloon on the inside slowly deflates over time, pushing a steady, controlled amount of medication through the tubing and into your body. It's not powered by batteries or electricity. It works completely on its own by a sensor which is taped to your skin in the chemo unit. And this helps to regulate the flow of the chemotherapy. It needs to stay in contact with your skin for the duration of your treatment. How long it takes to empty depends on your treatment plan. This can range from 1 day up to 7 days. In some cases, your infuser may need to be changed after just a few days. If that happens, your chemotherapy nurse will let you know when to return to the unit for a second bottle. Your chemotherapy nurse will connect your infuser to your central line while you're here in the cancer center. Once you're connected, the medication will start to flow slowly and continuously from the infuser into your body. You don't need to do anything to get it started. After your infuser is connected, call your community nurse to confirm what day and time it needs to be disconnected so they can plan your visit. When your infuser is empty, it will be disconnected by a community nurse at a community clinic. Your community nurse will also take care of a few important things to make sure your treatment stays safe and comfortable. They'll care for your central line and make sure it's clean and secure. They'll check that you have a spill kit at home and how to use it if needed. They'll arrange for a hazardous drug container to be emptied safely when they're full. They can order more supplies for you if you need them, and they're always available to answer any questions you might have. Once your infuser is connected, you'll go home and continue your regular activities while your treatment runs. You should wear your infuser at waist level. We'll give you a small bag to hold it comfortably. Choose loose clothing or shirts with buttons. This will make changing your clothes easier. Tuck the tubing as much as possible so that it does not catch on anything. Check your IV tubing and connection 3 to 4 times per day to ensure everything looks normal. You can even take a photo of your infuser each day to see the balloon slowly getting smaller. That means your treatment is moving along as it should. Your infuser and central line dressing must stay dry. This means taking a sponge bath instead of a shower while the infuser is attached. Avoid hot tubs, swimming, or any activity that could cause excessive sweating. And make sure the bottle doesn't get too hot or too cold. Extreme temperatures can change how quickly the medication flows. At night, keep your infuser in bed with you, either beside your pillow or in the bag attached to you. Here's what to do if something doesn't seem quite right. If you think your infuser is emptying faster than expected, use the clamp provided to stop the flow right away. This pauses the infusion and helps rule out a spill. Then call for help immediately. First, contact your community nurse and then also contact the Ottawa Hospital Cancer Centre Patient Support Line, 613-761-5444 from 9 a.m. to 4 p.m. or Care Chart at Home After Hours line at 1-877-681-3057. Your nurse will walk you through what to do next and make sure everything stays safe. If it looks like your infuser is emptying too slowly or it doesn't seem to be moving at all, contact your community nurse for troubleshooting. Anytime something feels off, it's always better to call and ask. We're here to help you stay safe and supported throughout your treatment. Spills don't happen often, but it's important to know what to do just in case. Cancer medications are powerful and hazardous drugs that can cause health problems if someone is exposed to them in ways other than prescribed. Safely managing a spill at home is essential to protect anyone who might touch or breathe in the drug. A leak of any amount is considered a spill and should be cleaned up quickly. In the event of a spill, use the spill kit provided to you. If you don't have one, you can also make a spill kit using supplies you have at home. 2 pairs of disposable gloves, paper towels or absorbent pads that can be thrown away, dish soap or liquid laundry detergent, 2 plastic bags that can be sealed or tied shut. If possible, the person who is receiving treatment should clean the spill. Make sure any pets, children, or anyone who's pregnant or breastfeeding stays away from the area until it's clean. First, open the spill kit and put on both pairs of disposable gloves. Then, clamp the tubing on your infuser with the clamp provided to stop any more medication from flowing. Use the paper towels to soak up the spill. If you're using the absorbent pads provided, make sure the shiny or blue side is facing up. Do not wipe the spill, just allow it to absorb. Place the used paper towels or absorbent pads into one of the plastic bags. Clean the area 3 times with a disposable cloth or paper towel, dish soap, and water. Then, rinse the area twice with clean water. Place all used supplies and your outer gloves in the first plastic bag. While still wearing the inner gloves, tie the first plastic bag and place it into the second plastic bag. Remove the inner gloves. Place those gloves into the second plastic bag and tie the second plastic bag shut. Keep the sealed bags somewhere safe and away from people and pets until your nurse tells you how to dispose of them. Wash your hands with soap and water. Once you've cleaned the area, call your community nurse and let them know about the spill. Then, call the Ottawa Hospital Cancer Centre patient support line during business hours or the care chart at home if it's after hours. Let them know that you have not received your full dose of chemotherapy due to a spill. The nurse will ask you to describe approximately how much medication was spilled. You now know the basics of using your infuser. Your care team and community nurse are always here to help and answer questions. Thanks for watching.